Hello, my name is Ethan Slaybaugh. I'm a freshman nursing student at the University of Michigan. I've just completed my first clinical this semester at Glacier Hills Rehabilitation Center in Ann Arbor. I worked with a patient who was 74 years old. He is a white, retired male who is happily married. His usual source of medical care is his wife. His vital signs were stable. He had a heart rate of 81 beats per minute and a respiratory rate of 22 breaths a minute. Patient's chief complaint is his weakness of right lower extremity and stroke. He had a seizure on January 11th, and that's when the weakness of his right lower extremity started to show. Patient states his leg used to hurt, but not much right now. The chief complaint affects his daily activities because he's unable to walk. Patient has a history of stroke with expressive aphasia and dysphagia. The expressive aphasia is due to cerebrovascular disease and disables him from being able to talk well. He struggled expressing his thoughts to me. Regarding health history, patient has COPD, chronic diastolic heart failure, and he's had surgery on his left leg. Patient states he has no allergies nor drug reactions. He's on numerous medications for COPD and heart failure. Now I'll talk about the functional assessment. Patient states he used to exercise before his leg injury. Patient states his rest/sleeping patterns are pretty good. He states that his nutrition is healthy and that he does not intake that much caffeine. He and his wife are close to one another, and she is there for him in his time of need. It seems their relationship is a good support system for their health issues. He used to go to church every week before he was unable to walk. His highest level of education is high school. Now I'll talk about the patient's family history. His father had heart failure, and his mother had coronary heart disease. Now I'll discuss the root systems and the patient's general health. Patient stated he has lost 17 pounds, but still has moderate energy levels. He denies any fevers or night sweats. Cardiovascular. Patient has COPD and CHF, so I thought it was important to listen to the patient's heart sounds. Patient denies any cramps in his legs. He states there is some pain though in his right leg. Patient denies of any swollen glands. Patient also states he used to exercise regularly, but cannot now because of his leg. But he states he's unable to perform all the activities needed to meet his personal responsibilities. After palpating his chest, I did not feel anything abnormal. There was no lifts or thrills. After listening with both the diaphragm and the bell, I did not hear any abnormal sounds or murmurs. He had a normal S1 and S2. Patient was unable to roll on his left side, so was unable to osculate for a better S3 or S4. Respiratory. Patient has COPD, so I thought it was a good idea to assess his respiratory system. Patient states he is able to carry out activities without a major change in his breathing, although he is unable to perform daily activities because of his leg. Patient states he does not have physical problems breathing, although when I looked at his charts, it seemed as if he did have a hard time not that long ago. In his charts, it said he had tachypnea before. He stated there is nobody in his family with respiratory disease or problem. When I had observed his chest, he had a 2:1 AP transverse diameter. He did not have any injuries or deformities in his chest, although he had recently had work done on his abdomens. Patient had normal tactile fremitus. When I osculated, he had diminished press sounds. Bronchophony, egophony, and whisper-typical were all normal. Pertinent System 1. Neurological. A neurological assessment is important to do for when a patient has a stroke. According to Dromerick and Redding, it is important to assess the neurological system on patients who have had one or more strokes because patients who have suffered a stroke are more likely to suffer from depression, musculoskeletal pain, falls, and other neurological complications. Pertinent System 2. Musculoskeletal. A musculoskeletal assessment is important to do because he's had a stroke and because of his chief complaint of his right leg. According to Poole, it is important to assess musculoskeletal on patients after a stroke because there is evidence that strokes lead to a reduction in bone mineral density, altered calcium homeostasis, and an increase in hip fractures.